Hi, this is Dr. Scott Harrington. How's it going, Denise and Mike, and everyone there in Raleigh, North Carolina?
Hey.
Hey, everybody. Wow, it looks like everybody can hear me. This is great. I'm hailing over here from Palm Harbor, Florida, around the Tampa area. And it just brings me so much pleasure to come out and be able to present to you today. I'm going to go ahead and share my screen. Let's see if we can do this. Mike, go ahead and let me know how I'm doing. I need to have my screen sharing enabled. So Mike's going to do some, maybe try to get my screen share enabled. If that doesn't work, that's okay. We'll just, we'll talk. And then we'll have time for questions at the end. All right. Okay, it looks like this is all going to work out. Let's get this started. And here we go. I see some people going by on the scooters. Awesome, awesome, awesome. Okay. So yes, my name is Dr. Scott Harrington. I've created a practice that's 100% telemedicine for people outside of Florida. If you're in Florida and you live near Palm Harbor, you can see me in person. But I have a plant-based telemedicine practice called veganprimarycare.com, where people can see a vegan and plant-based doctor with no commute, and they can reach out and talk to a plant-based doctor. I'm board certified in family medicine and soon to be board certified in lifestyle medicine as well, where you can see a vegan doctor from the comfort of your own home and get labs ordered and referrals and that sort of thing. And I can be your primary doctor. I can be your vegan advocate, vegan health advocate. So what I'm bringing to you today is what happens when you've gone vegan, except your health is not 100%. Vegan, still sick. Now what? What do you do now? Well, we know that the vegan diet can prevent and reverse common illnesses. And so there's a lot of expectations when you go on a vegan diet, and you're expecting your diet to do an about face to turn around and everything improve. We know this. We know this. We know this because when one really amazing study about the vegan diet is when they studied the Adventists in the Northwest of the United States, because there were Adventists that were 100% vegan, and there was also some that were eating meat and had a variety of diets. And this was a very special study because it showed a dose-dependent relationship on the amount of animal products that are eaten and the health parameters. So what the Adventist health study showed was that as they ate less and less animal products, their health got better. So there was less obesity, less diabetes, and less blood pressure. And it went in a very dose-dependent manner. And you know that you get, when you see this, you know that it's a very valid type of study. We know that that was reversing or preventing illness. This is reversing illness. Dr. Ornish and Dr. Esselstyn has proven that with a plant-based diet, you can actually reverse coronary artery disease. If you eat a very healthy, low-fat, plant-based diet, they actually prove that they can reverse the #1 most common killer in the United States, which is coronary artery disease, which leads to heart attack. So you've heard about these miraculous studies. You've even seen people have miraculous weight loss. Like this is Richard Hubbard, for example, at Healthy Living, Connecticut. He lost over 150 pounds and he's kept it off. Say, my goodness, this is amazing diet. So what happens when it's not working exactly like you expected it to? I joke around that when my health is not 100% perfect, I joke around, I say, oh my gosh, what's the deal? I'm on a vegan diet. Everything should be perfect with my health. But sometimes even vegans get sick. So this is, you expect it to be unicorns and rainbows. And then what happens when sometimes it falls a little bit short? It can be very frustrating. What's going on? So what can be expected? What are some of the typical reactions to starting a plant-based diet or vegan diet? Well, if you go on a low-fat vegan diet, you can make heartburn basically disappear right away. You can stop having heartburn by eating a very low-fat diet. And that just happens immediately. After a couple of days, then constipation is basically cured. Your bowels start, if you stop eating foods that contain no fiber, like meat, cheese, eggs, and fish, then only the food that you eat is going to contain fiber and help your bowels be regular. About in 1 week, you start noticing weight loss because the plant-based and vegan diet is lower in calories in general than a regular omnivore diet. After about 6 weeks, you start seeing inflammation in the joints come down, inflammatory processes like acne and start to improve dramatically. And so, well, how does this all happen? How do you do it just right? How do you make it happen with some good expectations of success? You have probably heard about the whole food plant-based diet with no added salt, oil, or sugar. Oh my gosh. Oh my gosh. So we want you to be eating low amounts of processed foods and avoid these food additives, these drug-like food additives. So the salt and the sugar, it kind of reminds me of when you see on TV, you see like drugs, it's these white powders. And so these are drug-like foods, the salt, oil, and sugar. So let's talk about what the salt and the sugar does. One of the things that happens is it kind of hijacks your taste buds, especially the salt and the sugar. Salt and sugar enhances the flavor of food. And so what this picture shows, if you can't see it in the back, on one side, you've got very vibrant colors, and this represents your tongue when your tongue is not overexposed to salt and sugar, where it's very sensitive to the natural foods and the natural flavors. But on the other side, there's a dull picture. And this happens just when we're used to eating such strongly flavored food, strongly flavored with salt and sugar, we start to not appreciate the natural flavors and they don't seem as robust. And so this can be a problem. And once you start weaning yourself off of salt and sugar, you start to appreciate things better in terms of the natural flavors. So I have a little saying about salt in particular. Salt is a real bad one. And we've all heard of those potato chip ads where they talk about how you can't just have one, because once this happens with me, I noticed that when I put one of the potato chips in my mouth, the other one is already in my hand and is ready to go in my mouth before I even think about it. We know that that salt increases weight because you eat more. It just causes you to eat more calories. And even when they study animals in like rats and labs, they can make the animals obese by adding salt to the kibble for the animals. So this is how they make it in lab. They study obesity in lab by using extra salt and causing the animals to eat more. So when salt is in your body and when you're eating it, you can't stop. It's almost like you're on fire. Okay, careful, you are on fire. You're in a frenzy. And so what do you do when you're on fire? What did they tell you to do in kindergarten? They told you to stop, drop, and roll. Stop, drop, and roll. This is what this is you have to stop what you're doing. You have to notice that you're being hijacked by salt, like the bag of chips. You have to drop the salt, drop the chips, get out of there, and then reflect. Oh my gosh, I was just hijacked. My taste buds were just hijacked by salt. So that's a little tip about salty foods. Be careful. Now this slide might be hard to see in the back, but this is directly stolen from Brenda Davis, an amazing dietitian who talks about the whole grain hierarchy. And I mention this because a lot of times we say whole food, and specifically we talk about whole grains. And so it's interesting to think about the grains in this hierarchy of processing. So intact whole grains would be the best because they have the slowest digestion and they sustain you for longer and there's less insulin spikes. But as you go down this hierarchy, you have more and more insulin spike. The calories kind of sustain you less time, and you get hungrier faster, and they're less healthy for you. So steel cut oats is not as good as intact grains. Rolled oats getting more processed. Shredded wheat getting even more whole, then flour being ground down into flour. And this is what two things you don't tend to think about. Flaked like corn flakes or wheat flakes in cereals, really highly glycemic. And then the last but not least, the most highly glycemic and processed grains are the puffed wheat, puffed corn, puffed rice cakes. These things are really glycemic, high glycemic, and they have deleterious effects. So that's what we mean when we say whole food, plant-based. So let's talk briefly about what do you do when you've gone plant-based or vegan and you're not losing weight. That's not supposed to be how it goes. So first off, make sure that there's no animal products creeping in. So this might be in the form of butter. It could be, milk or baked goods and stuff like this, eggs and baked goods. So be careful to start with that. Next, make sure you're eating the foods in the whole form. So the concept is the idea of the difference between eating one apple versus eating an apple juice. You can drink the apple juice really fast and get a lot of calories, but when you're trying to eat the apple, it slows you down and you get better metabolic effects from eating the apple. The next is oil. We know that oil sludges up the blood, and we know that it's 9 calories per gram of fat. Oil is liquid fat. Oil needs to be in the same category as we think of like high fructose corn syrup. Back in the day, we were all worried about our soda drinks, which is still a problem, but we didn't put olive oil and oil, cooking oil, in those same sort of categories of being deprived of all the other nutrients and just straight up calories. And when they go in our body, it's an inflammatory state. Anyway, when we're trying to lose weight and we're failing, sometimes it's because oil that we're used to cooking with is creeping in. And it looks like you're eating, like, say, fajitas, for instance. When you go to eat fajitas in the restaurant, you'll get a bunch of cooked vegetables to put in the wrap, and it will say it looked very healthy. But if it's loaded with oil, it may have a lot of extra calories. It might be inflammatory and you're not realizing. So be careful with oil. That's a big one. We talked about salt. Let's talk about caution foods. Dr. McDougall has a green light, yellow light, red light handout that he gives. And the yellow light caution foods that he talks about are healthy foods, but they have high calorie density. These include avocados, nuts and nut butters, dried fruit, and tofu. These foods are healthy, but they're a little high in calories. So if you're trying to lose weight, you kind of want to be careful and eat very small portions of these foods in general. Also, if you're trying to lose weight, there's lots of other resources, like Dr. Greger's has an app, the Daily Dozen app, and he has in that app, he has Dr. Greger's 21 tweaks. It's a free app, and it has 21 tweaks, different things you could try to help lose weight. It's very helpful. Okay. Let's say you're plant-based or vegan, but you have high cholesterol. Hey, what gives? I'm not eating any cholesterol. What's the deal? Well, omnivores have about 80% of their cholesterol from their genetics and 20% from their diet. Vegans have 100% of the cholesterol from our genetics, but we can help excrete and get rid of more cholesterol by doing a couple things. One is including a lot more plant fibers and even plant sterol supplements. Plant sterol supplements are proven to help reduce cholesterol. Plant sterols are high in beans and oats, and vegetables that kind of have sort of a gelatinous or a slimy kind of consistency, sometimes like okra or eggplant can have that. That's the sterols that you're experiencing. Saturated fat. Saturated fat makes the receptors in the liver not bring the cholesterol back into the liver as well. So the saturated fat is a problem and can raise your cholesterol, even though it may not be from an animal. And one thing that I'm really sad about is that, I've learned that coffee can actually increase your cholesterol as well, especially the unfiltered coffee, such as espresso, and if you're using the French press. So that is sort of a sad thing. So if your cholesterol is elevated, think about that too. Okay, all right. The next thing, let's say you are plant-based, but you have elevated blood pressure. What gives? Well, we talked about salt. We know that where salt goes, water goes. And so if you eat more salt, the kidney has a hard problem with blood pressure because you hold on to water and you have swelling. And so salt is one of the biggest concerns with blood pressure. Stick to 1,500 milligrams or less per day. The next thing, if you're drinking alcohol routinely, alcohol can raise your blood pressure. Alcohol is a depressant. And so in the feedback, your body's feedback is to amp up the blood pressure over time. So this is something you got to be careful with. Animal protein is a problem, and it can cause the kidney have to filter out more animal protein. There is an even concern if we're overdoing plant protein, things like protein powders and these kind of things. You don't want to give the kidney extra work to do. So avoid protein powders in general, unless you need extra calories. If you can't get it in, if you're having problems with your teeth, or you need extra calories, calorie shakes can be helpful, but in general, we want to avoid them. There's a couple of things. Obviously, fruits and vegetables help with blood pressure by displacing other bad foods, by being high in potassium, and just metabolically being helpful. Populations that eat the most fruits and vegetables have the lowest blood pressure. So there are a few other tips. That includes flaxseed. Ground flaxseed has been studied against placebo to help decrease your blood pressure. So I will include up to 2 tablespoons of flax per day. I put it in my oatmeal and smoothies and stuff like that. So that also has omega-3. So this is really good. Hibiscus tea is another tip. You can use like the passion tea, Tezo passion tea, or the, I think it's Celestial Seasonings or something, red tea. This has hibiscus, or you can make it yourself with hibiscus leaves, dried hibiscus leaves. It's really sour, so be careful. You may have to watch that, but it does help to decrease blood pressure. 5 tea bags and 2 cups of water is a typical dose that's studied. All right, so if you're having problems with these issues, the first thing you got to do is belief in yourself. The plant-based diet definitely works, and just kind of keep an eye on those. Make sure it's whole food, and watch out for oil, salt, and sugar. And you can do it. You can do it. And if you're still having problems with this is kind of where I come in. As a plant-based doctor, I can be your primary care doctor. Get a doctor who gets you. With my practice, Vegan Primary Care, I have a license currently in North Carolina. And so I can see patients. They just reach out to me at veganprimarycare.com, and they can book an appointment, and I can come straight to you in your home. So I'm a family medicine doctor. So how can I actually be your primary care doctor online? That seems kind of crazy, right? Well, it is the wave of the future. What I do recommend is my patients to get a blood pressure cuff that you can have at home, and we can handle most things online. We could get you referrals. I can get med refills if needed. Mostly, as a primary care doctor, I'm giving you advice about your health and helping to guide your lifestyle changes that can get you in the right direction. So I'm in lots of states, in most US states. And so I have patients from all over, folks from Alaska and Hawaii and North Carolina and Florida. And it's just been a real joy to be able to reach out to vegans all across the country. Another thing that I offer my patients who see me is the Get to Your Goal weight loss meeting. This is a free visit that patients in the practice can do every Tuesday night, where they come and it's a kind of like a Weight Watcher style meeting where everyone goes over what went right over the last week in terms of their weight on their whole food plant-based journey. And it's a social support situation that people help each other out. It's really great. Get to Your Goal meeting every Tuesday night. We are also, if you have a plant-based business, a vegan business, and you want to have me as your employee healthcare doctor, I can provide a certain amount of visits per year for your employees, and you could provide that for them, and including lab work and the weight loss meeting and that sort of thing. And I could be the person they reach out to. You can help keep your employees satisfied and keep your business healthy and running strong. Okay, so what I've purposely done is stopped a few minutes early so that we could have a chance to answer your questions if you have any questions. And Mike and Denise and other folks there are going to help with asking the questions.
Okay, so how this is going to work is if you have a question, just go ahead and raise your hand. You can ask it, and then I will repeat it in the microphone so everyone can hear it, as well as Dr. Harrington. You know what? Yes.
She has a question about no oil. She's still asking it. She wants to know why you're saying no oil.
Okay, so we had a question about the rationale of limiting the use of oils.
Great question. The question was about decreasing oil. No oil is ideal because with the theory of the whole food diet, the food that you eat comes in a package that was designed to be digested by your body. When you create, when you damage the food, or when you strip out certain nutrients from the food, it creates metabolic problems. So for instance, the oil in olive oil versus the olive. The olive is always a better and healthier food because some of the oil is trapped in the fibers of the olive. And when it's harder to digest, and so you get actually less fat from olive than you do from olive oil. And so the same thing with all the other things like canola oil and corn oil. It's kind of the same reason why we don't like high fructose corn syrup. There's just the sugar. You don't get any of the fruit or any of the other nutrients and antioxidants and the healthy fibers that you get from these other foods. So, but that may not convince you enough. That may not convince you enough because you say, well, geez, that, I've used olive oil, all my life, or, and it's healthier. It may be healthier than other heated oils that are less, that are clearer and have less, it might be slightly better than that, but still it's bad. It goes right into our bloodstream and sludges up our blood, slows down the flow of the blood in the blood vessels, and it's inflammatory, and it causes a narrowing of the vessels. It actually causes the vessels to clamp down. So for many reasons, it helps to sludge up the blood, and it's bad for you basically. So you want to try to avoid olive oil as best you can, and other oil products, added oils, fried foods, they're unhealthy for you.
Okay, so we have another question. It was, how do you feel about calcium supplementation?
How do you feel about calcium supplements?
Calcium is a sort of a story that went from a blessing to a curse. We know that you need to have calcium, and you can get plenty of calcium on a plant-based diet. In greens, beans, and grains, you get tons of calcium. We know that in the nurses' health study, that where they followed nurses for years and years, and doctors were always telling women to go on who are postmenopausal to go on calcium so they make their bones strong. But as they looked at the data over time, they found that the calcium supplementation was problematic and it caused more blood clotting in these women. So now if you have osteoporosis and you need to have high calcium, the recommendation is to try to get it from your food and to only supplement up to the dose of 1,200 milligrams, depending on what you're missing from your diet. And the easiest way to do that is with a food log called Chronometer. You can test how much calcium you're getting, and you could supplement up to that to 1,200 milligrams if you needed to. But in general, you should try to get your calcium from your food, and you should avoid trying to get calcium from things like milk, which can be problematic for different hormonal reasons and saturated fat.
Okay, we have one more question here.
She's on a low dose of
Hi there, thank
Crestor,
you.
I think, and she wants
I've
to know
got
why she can't get off it because her cholesterol
issues
shoots up.
with my grandfather having been on the first heart transplant list, and I'm on a very low dose of Crestor of 2.5 milligrams. And I've tried to get off of it, and when I get off it, my cholesterol went up from like 180 to 256. And I'm wondering how I can try to continue to try to get off of this medicine.
Great question. How do you get off cholesterol medicine? A lot of patients want to get off statins because there could be a slight risk for diabetes, or some people have muscle aches and problems. And there are ways to help reduce your cholesterol without statins. And the two supplements are Indian gooseberry called amla powder. A 500 milligram capsule daily is the studied dose of that. Or plant sterols. Plant sterols, they do come in 500 milligram capsules, and you take 4 per day throughout the day. And these sterols help to reduce your cholesterol.
I'm not sure if you have time for it.
And then watch the saturated fat, and sadly, watch coffee a little bit. Those are things. So if you try that, the goal, always the goal is to get your cholesterol as low, LDL as low as possible. We would like to try to get around 70 or less, because that is where you turn the corner and the body starts producing atherosclerosis. So this might be the end of my time. I could definitely help you with that if you're my patient. It's been a pleasure to reach out to you, and I just feel honored to be here today and be with the likes of these special presenters. And it's just been an honor.
A lot of people with dogs, and it's getting a lot of people to try us out.
Thank you, Dr. Scott Harrington, for taking time out of your day to come talk to us. Really appreciate it.
Awesome, awesome. Go vegan. I look forward to seeing each and every one of you. Thank you.
Okay, so we're gonna take a second to